Hello everybody, my name is Teresa. I am here with Path to Passing to give you a 5-minute video breakdown on lower extremity veins. So first I want you to focus on the diagram here. I have two legs and I have the veins drawn out. We're going to go over what these veins are at different points in the body. Okay, so first up here we have our IVC, or our inferior vena cava, and then we have our common iliac vein. And then we have our internal iliac vein. And then we have our external iliac vein, our common femoral vein. Okay, and there's a lot going on right here. That's okay. Don't let it confuse you. Just know where you are at every time. So common iliac vein, then you have your internal, then you have your external, then you have your common. Okay, right inferior to the common femoral vein, you have the saphenofemoral junction, or your SFJ. We use this as a term in ultrasound. This is very important in reflux studies as well as other things, but this is the region of your saphenofemoral junction. Here you see I created a purple vessel and I had it go down the leg. Okay, this is your greater saphenous vein. The reason that I have it a different color than the rest, because this is a superficial vein. Okay, superficial vein. It is not a deep vein. Okay, so when blood clots are in the greater saphenous vein, we aren't as concerned about them as if they're in the deep system veins, which is going to be everything here in blue. Okay, so as we come more inferior, we have our deep femoral vein, or this is also known as your profunda femoris. So deep femoral vein, I wrote it out over here. And then you have your femoral vein, okay? Your femoral vein, okay? The profunda femoris sits deeper to the femoral vein, and that's why we gave the name deep femoral vein. And then as you come inferior, you have your popliteal vein. So you're still in the same vein, it just changes names, depends on where it is on the body. So you have your popliteal vein, you have your ATV, okay, or your anterior tibial vein. You have your PTV, or your posterior tibial vein, and then in between those two, you have your perineal veins. All right. So I went over here and I created this diagram. I wanted to be known that in the venous system, blood moves from the digits up. Okay, it moves up. So veins go up, whereas arteries come down. Okay, so when we talk about veins, we would say two veins join together to become a new vein. I created this so that it could be helpful for you to know. The posterior tibial vein plus the anterior tibial vein plus the perineal vein, they join together to become your popliteal vein, okay? Which then becomes your profunda femoris, or your deep femoral vein, and your femoral vein, which then become your common femoral vein, which then becomes the external iliac vein. You have your internal iliac vein, common iliac veins, and then you get up to your big one, which is the IVC. So smaller vessels come together to become larger vessels in the venous system, okay? In the venous system. And then I want to come over here. This is a picture I drew of the back of the leg. So you have your femoral vein, which is a part of your deep system. And then again, I went ahead and drew in purple your superficial vein, okay? This is called your small saphenous vein right here. And it comes, you see, it comes here, there's purple, and it's before it becomes the popliteal vein. So femoral vein, popliteal vein, okay? This is superficial, okay? The greater saphenous vein and a small saphenous vein are both superficial veins, okay? So there's that, and then don't forget about the saphenofemoral junction. The last thing I want to talk about is DVTs are most common, or deep vein thrombosis, are most commonly seen in your popliteal and your femoral vein, okay? Popliteal, your femoral vein. And then valves. Let's talk about valves real quick. So valves are in veins only, okay? When it comes to veins and arteries, you will find valves in the veins. The valves are like two doors, okay? When blood flow goes up through the vein, the valve is meant to be a shut door so that that blood can't fall back through the vein, okay? We want veins, we want blood to just go from inferior to superior. You're not allowed to go backwards, okay? This is not an open door policy. So with that being said, If the vein allows blood to go back through the opposite direction, that is an incompetent vein, and that is what we look for in reflux studies. Whole different video, we're not going to talk about that today, but veins have valves, arteries do not, okay? Thank you for checking out my video, Path to Passing. Make sure you subscribe, and I can't wait to see you on the next video.